All right. Hi, friends. My name is Bill Evertsberg, and I'm one of the ministers at Kenilworth Union Church, and this is Doogie, my assistant minister. I've never served a church with so many stained glass windows. I love the stained glass windows in all our various rooms. And it'll be clear in a minute while I've positioned us in front of this window. It says mercy at the top, but famous doctors are in this window, or famous healers, I guess I should say, Mother Teresa, Albert Schweitzer, David Livingston. And so it'll be clear in a moment why we're sitting here. This is Jeff Snell. Jeff, where are you from? And tell us how long you've been a member at Kenilworth Union, and how did you find the church?
Well, I'm from the area. I was born in Evanston, and then my family moved to Kenilworth when I was in second grade, and we became members of the church at that time, and I've been involved in the church ever since and stayed in the area ever since. I went to New Trier, and I went to Northwestern, and then I went to medical school at Rush, where I've worked ever since I graduated. I did all my training at Rush, and I've been there on the faculty ever since. My wife, Chris, and I were married in the church, and both our children, Kim and Jeff, were baptized here, and Kim and her husband Scott got married here. They even got engaged here on Christmas Eve, because they knew how important, Scotty knew how important the church was to everybody. And their daughter Amy got baptized here, and they have another one on the way. And my son Jeff is also a member of the church, and it's been very important to our lives.
Your family is much beloved by the congregation. Thanks for your faithfulness and everything you do for the church. So what specialty do you practice at Rush? You teach and practice medicine.
That's right.
At Rush.
I'm a professor there, and I am an interventional cardiologist. So I fix blocked arteries, but I also trained and board certified in critical care medicine. So my job's been a combination of doing procedures, being in charge of an intensive care unit.
You're in charge.
In the heart intensive care unit, and also I've been there for a long time, so I have a big practice there.
So how has your life changed since the pandemic fell upon us almost a year ago?
Yeah, it was almost exactly a year ago, and as you may know, Rush was kind of in the center of the response to COVID, partly based on the hospital design, which was very oriented around intensive care units. So at baseline, we have 4 intensive care units, one of which is our heart intensive care unit. There's a neurology one, there's a medical one, and a surgical one. And when the pandemic hit last March, it got very busy very quickly with COVID patients, and all 4 of our intensive care units stopped doing what they were previously doing and became completely filled with sick COVID patients. And we even opened up 2 additional intensive care units. So in March, April, and May, we had 6 intensive care units at the peak of this, filled with sick COVID patients.
How many beds is that total?
So about close to 200 patients. And because we were kind of positioned for this, in addition to patients who came through Rush, we were taking transfers of sick COVID patients from many community hospitals in the area.
Goodness.
So my job shifted, and the other one of the things about the pandemic that you may have heard of is everything else, elective procedures, people's routine appointments, all went away for a while. And for several months there, I was pretty much exclusively doing the care of very sick COVID patients in intensive care units. And then in the summer, it started to slowly change and get better, and the patient census of COVID patients started to decrease. And now we have a steady but smaller number of COVID patients in the medical intensive care unit, and our heart intensive care unit is pretty much back to taking care of heart disease patients with an occasional heart patient that also has COVID.
Are you back to doing heart things more? Or are you still caring for COVID people?
No, all of the general health care is pretty much slowly returned to normal. I would say it's still 80% of what it was pre-pandemic, which has actually been an issue for medical centers financially also. But, more importantly, we've been trying to convince patients that they need to get back and do their health care that they have
Yes.
not been able to do
Yes.
for a year, because everybody's worried that a lot of health care has been neglected for a
Yes.
year, and that may cause other problems in the
Yes.
not too distant future. So,
Yes.
we're back to seeing outpatients just like we always have, with all the usual precautions, and of course most of the medical personnel have been vaccinated by this point, and we're busily encouraging patients to get vaccinated and everybody else, so life can someday get back to normal.
From a layperson's point of view, through the media, it looks as if caring for, in your case, hundreds of COVID patients during this time was intense
Yeah.
and challenging. Did you experience that kind of intensity, or sadness, depression?
Pretty much all of the above at
Yeah.
various points. At the beginning, it was particularly difficult and scary. We didn't know very much about this disease, and it was not like other diseases. It didn't follow some of the usual rules, and patients got very sick very quickly, and didn't always follow. You would think maybe older patients with a lot of other illnesses would be more likely to get the most sick, and sometimes that happened, but it wouldn't be unusual that a young, otherwise healthy person would get extremely sick and pass away. And you add on top of that all the precautions that needed to be taken,
Yes,
where
right.
families couldn't visit, and so you'd have a dying loved one, and you could maybe communicate via FaceTime on a telephone or something.
Did you do some of that?
Yeah, I mean, everybody did that, but it was still very, very difficult for families, and and it was pretty it wasn't difficult for the doctors. I would say the nurses on the front line and the intensive care units, the respiratory therapists, some of the other people who were just working constantly at the bedside.
Wow.
I mean, that was extremely stressful as well, and they did a heroic job.
Great. Are they okay?
Yeah,
They're
I think,
beyond it?
there was a lot of consequences of this. Some people, decided that enough was enough and retired, or went to other things, But I think that Rush was very good at trying to support the personnel that were taking care of them, and I think everybody's pretty proud of the work we did as well.
Yeah, great. Well, Jeff, one of the reasons I wanted to talk to you is so a congregation could hear from somebody on the front line, but also we need to thank you and your colleagues for being on the front line and getting Chicagoland through this. Yeah. I'm glad your life is a little bit new normal, I guess that you would say. So here we are.
Yeah. It's good to be in the church again.
Yes, yeah. So here we are with two great doctors, Albert Schweitzer and Jeffrey Snell. God bless you, Jeff, as you go back to Rush, and God bless you all.
Thanks, Bill.
Yeah, thank you, Jeff.